Hi, my name is Dr. Viral Desai. I'm a board certified cosmetic and plastic surgeon and hair transplant surgeon. I have over 21 years of experience in this field, having run multiple centers across the country, with my main centers being in Mumbai and Pune, and sending teams and training doctors all over the country. So hair is a very essential part of our practice. Hair loss and hair transplant should be done by qualified people in the right manner, and if it is done correctly, you'll always get the best results. Now there are so many myths and so many facts which about hair and hair transplant which are not correct. Okay, one of the biggest myth that patients ask me, that hair transplant is only for men, doctor. When I suggest a woman that she may need a hair transplant, they say that hair transplant is only for men, doctor, and that surprises me. I used to see this a lot earlier, 15 to 20 years back. Of course, with education, it comes less today. Less patients ask this, but yet some patients do ask this. No, that's not a fact. Even women can get hair transplant, especially those who have their hairline thinned out or who have little thinning in the part lines or in the center. They will do very well with a hair transplant, provided they have healthy donor area and healthy hair there. Today, around 12% to 15% of the patients that we do a hair transplant on are women, and they get great results, which you can see. So you can see that hair transplant works very well for women too. Second, hair transplant is only for the rich people and for celebrities. Now I don't know where these kind of rumors or these kind of things come up. Why would anyone not want to look good? Doesn't not a layman or a common man or middle class man, they so-called lower middle class or middle class, go to the gym and make his health or look good or feel good or apply makeup or whatever he wants to do in order to look better? So similarly, why not hair transplant? Hair transplant is pretty affordable for everybody if done at the right place, in the right clinic. And the best part is you don't have to keep repeating it since the results are more or less permanent. So yes, it is for everybody, and whoever can afford should get his hair transplant done if he's bothered about his hair loss. Yes, it's not an essential thing. If he's not bothered, he can shave his head and be happy. Third, hair transplant is very painful, doctor. Again, I don't know where this originates from. Hair transplant is one of the most easiest and painless procedures. If you actually see some of our videos, if you actually see my channel Gaurav Gera's video where he's actually laughing and smiling, and JD's video on our channel where he's actually talking to the press and he's giving an interview while getting a hair transplant done. So by the new methods that we use for anesthesia, the ultra thin needles and newer techniques that we use for anesthesia, it makes it a very painless procedure. So hair transplant it has got practically no pain, and even post-operative you barely require painkillers. Some itching, some discomfort may be there, but not really pain. One more myth is that hair transplant is not for old patients. Again, why? Or in white hair. Why? White hair grow as well, or grey hair grow as well as colored hair do. So you can do hair transplant in any kind as long as the hair quality is healthy. Age is not a factor. But if you don't have good donor hair, number one, or you have medical diseases which are not able to control or uncontrolled, then you can't do hair transplant. That is even true for a young patient. If you have uncontrolled hypertension, you can't do it. You can always control it and do it. We've done patients who have had bypass done, who've had angioplasty done, who had even kidney replacement done. We've done hair transplant in them. As long as they are healthy, we can easily perform a hair transplant. One more thing, hair transplant is the results are not natural. Then you have not gone to the right place, or you've not done by the right people, or you've done by technicians and you've not allowed doctors or qualified doctors to do it. If you do hair transplant in the proper manner, especially with our technique, the DHI process, the results are so natural, the depth direction angle is so accurate, the designing is so good that you can't even tell which is a transplanted hair and which is a natural hair. You can see this in some of the videos on our YouTube where you can clearly see that the results are extremely natural that you can't make out. So that again, that means if you see around you, then the person who got it done has not got it done in the right hands. Another thing, patients say, and this actually surprises me in today's world, that hair transplant can affect brain because it is close to the brain, or it can affect some nerves which may cause permanent damage. Now, I'm putting hair at a depth of 2 or 3 millimeters into the scalp, okay, which does not have any kind of important structures. The brain is protected by the skull. If I want also with that particular needle, if I want to intentionally do it, I can't penetrate the skull in order to reach the brain. So not even 1 in a million chances hair transplant can ever affect brain or any other kind of nerves. So that is completely a myth, and please do not believe such false stories which go around, and because of that do not spread these things and educate people wrongly. Similarly, another ridiculous thing which I've heard occasionally is people say that hair transplant can cause cancer. I'm taking your own hair, your own root from the back of the scalp and putting it in the bald areas. How can it ever cause any kind of cancer? It's a complete myth and it should be abolished right away. Please, again, warning, do not spread such rumors, and if anybody spreads such rumors, please tell them to shut up immediately or keep quiet immediately. One more thing, a hair transplant is for anyone and everyone. Now that is also another extreme, saying that hair transplant is not for me and now it is for everyone. No, proper assessment is important. You may just be an early candidate of hair loss where you don't need transplant, you need medical therapy and other procedures. You may be a candidate who's got donor area affected. In that case, you can't do hair transplant, it will fail. Or you have not good hair in the donor area, not healthy hair. So through a trichoscopy, you need proper evaluation in qualified hands to understand that this does not happen and you do not get failure. So hair transplant is definitely not for everybody, but for the right people, and this can only be determined by a proper doctor, qualified doctor, board certified doctor who has good experience into this. If you do like this video, like, comment and share it. Also book a consultation with us if you want to know more about hair loss or hair transplant and such myths and facts which are busted. Do educate yourself correctly and educate others correctly, and please follow our channel to know more. Thank you.